Nicole Hartmann is a board-certified neurologist and epileptologist. She graduated medical school in 2017 from Rowan University School of Osteopathic Medicine in 2017. She completed her neurology residency at the University of Maryland, followed by an epilepsy fellowship at the Hospital of the University of Pennsylvania in 2022. For the last year, she has completed an epilepsy clinical instructionship also at the University of Pennsylvania. This summer, Dr. Hartmann has just joined the Laurenceville Neurology Center practice, seeing patients in Central Jersey as well as in Penn Medicine Princeton campus. She's continued to work with the Penn Epilepsy Center to open an epilepsy monitoring unit at the Princeton Medical Center. Dr. Hartmann is most proud of being a former Epilepsy Services of New Jersey Scholarship winner. And that's always how I will see Nicole Hartmann, even though she's a big neurologist now. So at this point, I just want to introduce Dr. Nicole Hartmann. Thank you so much, Nicole.
Thank you, Andrea. It's great to be here. Thanks so much for inviting me. And I'm hoping that this talk can be informative and helpful to everyone listening. All right, so I have no disclosures. So these viewpoints are my own, just based on my own personal experience, research, and my training, and they don't necessarily reflect that of the Epilepsy Alliance of America or Epilepsy Services of New Jersey. So these are my objectives. So these are the topics that I'm planning to cover. I'm hoping just to cover the main college experience and how it pertains to having a diagnosis of epilepsy. So discussing medication management, seizure rescue and action plans, seizure safety, seizure threshold, mood disorders, and contraception. So a little bit about me, and also first, you're off to college. Now what? So now all this time, you've been living with your parents, they've been helping with medications, and you've had a set schedule, and now you're embarking on your own. So a little bit about me. This is a picture of me graduating college in 2011 at Elmira College. And so actually I was diagnosed with epilepsy at age 15. So I have some experience, well, a lot of experience, personal experience living with epilepsy, living at college with epilepsy. And also I've been through medical school, and now I'm an epileptologist. So here I am, but hoping that my personal experience, my professional experience can all be very helpful to everyone. So the basics. First things first, visit your neurologist. I love these summer visits personally. I love seeing all the college kids during the summer before they're off to another year of school. So I would say before you leave to school, plan to meet with your neurologist or epileptologist and discuss your college plans. Are you living on campus? Are you planning to commute? You also may need some forms signed. I fill out seizure action plans and forms and sign them for medical directors, things like that all the time. And also, do you need any accommodations for classes, whether it's more time and access, things like that? And that's our second presenter. We'll definitely talk more about that. Other things to think about as well, your medication plan. You've been going to the same pharmacy for years, or mom and dad have been picking them up from the pharmacy. And so if you're going out of state or someplace far from home, how are you going to get your prescriptions? Will it be on campus, or will it be at a local pharmacy? Something which I learned actually as I was preparing this presentation, if you actually can't mail prescriptions from home, it's actually illegal if you don't have a DEA. And also, where are you going to fill it? And the next thing too is also having a rescue plan if you were to have a seizure at school. So more on medication, how much do you have? Where are you going to keep it? You're going to be living with people. Is it going to be safe, or are you going to keep it, especially if you're on a controlled substance? How are you going to take it with you? There's pill boxes. I used to hand out pill boxes all the time at work. I used to get them from various people and hand them out to my patients. Are you going to keep travel cases, keep them in your purse, etc.? Always have a plan for staying out from when you're in your room. You don't know where your plans are going to take you sometimes. So always keeping a little medication in your backpack, in your purse, in your wallet, things like that. I think I still find medication for myself. I've been on medication now for, oh my God, almost 20 years. And I still take epilepsy medication and carry it with me everywhere I go. So I still find small containers of them in various bags and suitcases. And seizure safety plans. I think this might be one of the most important things to discuss with your neurologist, as well as on campus with whoever that may be, your RA, your health services. So having a seizure action plan, and we'll go into, I stole some some things from the Epilepsy Alliance of America that show you what a seizure action plan can look like. And who are you living with? So do you feel comfortable sharing your diagnosis with them? I would hope so, especially if you're going to be living with that person. A roommate is an important person in your life, often become lifetime friends. I am more comfortable with disclosing my diagnosis with people, and I have been when I meet people that I'm going to be staying with. As I've kind of gone through life, I tend to educate people on what, seizure first aid is. This is what to do if I'm going to have a seizure. And how often are you alone? So are you going to be alone in your room every day? Is there anyone going to be checking on you in certain periods of time? And of course, seizure first aid, like I was saying. Your RA is going to be definitely one of the most important allies for those who haven't been college students yet. An RA is typically another college student, usually a junior or senior, and they live on the same floor as you. And they're basically sort of in charge over the floor, and they're your go-to person for any issues, concerns, things that you may run into as a college student living on campus. And then what is your seizure action plan? Finding out at your specific college, it may have different protocols. What's the emergency protocol at your dorm? What happens if 911 needs to be called? And do you have documentation of your seizure action plan that could be readily available to those who may need to access it? So this is a really nice example of what a seizure action plan can be. It doesn't need to be this way. I filled out so many different kinds of these before for anybody that is in, high school, college, typically. I like in this one that it has who they should contact, your information, what your seizures look like, what kinds of seizures that you have, and also what kind of care that you need. It basically provides seizure first aid on a piece of paper for anybody that may not know. And also what kind of rescue treatment do you have? And that I'll be going into a little bit more. And then there's a final portion, which I really think is important, is when to call for emergency. As I think a lot of when you have a seizure, you don't need to go to the ER necessarily every time. So just making sure you have parameters that you and those around you will understand, and to when you should go to the ER. So seizure rescue, this is probably one of my most important topics, the topics I talk about with just about every single patient that I have. What is your rescue plan? So this is not going to focus on the details of the different rescues, but at least knowing what the different options are if you don't have one. I think it's particularly important if you have convulsive seizures or big shaking type grand mal seizures, as we sometimes call them. Sometimes patients that don't have those kinds of seizures, don't necessarily have a seizure rescue. It depends on your type of seizures, your epilepsy, and also your discussion with your neurologist. But there are different options. Now there are nasal sprays, which didn't exist 15 years ago. There's two different kinds. They are Valtoco and Nasolam. Then there's rectal gel, which usually is used more in pediatrics. It's called Diastat. And then there are also orotabs, things like clonazepam that are dissolvable. And also if you have a vagus nerve stimulator, making sure that you have your magnet, and also included on your seizure rescue plan, what to do with the vagus nerve stimulator magnet as well. This is a link from the Epilepsy Alliance of America, which is a great website. So that way, if you don't know how to use your Nasolam or your Valtoco or any of the other rescues, it actually shows you how to do it and how to administer it. And a lot of times, actually, at my office, I have little samples that have a little respirator that show you how to use it as well. So I try to give those to my patients so everyone knows how to use it. Things that should be considered. So medical alert products are very helpful. This one through the Epilepsy Alliance of America, they actually have a discount code for them, I believe. It's called My ID, and a lot of it is scannable. And you can go on the website and you'll scan the ID, and it actually takes you to a website that has all of your information on it. Just in case you are out and about and by yourself and you happen to have a seizure unattended, it would be, I think, a good safety protocol to have a bracelet or a medical ID. And they actually are a lot more fashionable nowadays and not as obvious necessarily. I think as long as they have a little star that is obvious to healthcare providers that EMS may get called, so that way they can see it. And so things that I would include, that your name, an emergency contact, the fact that you have epilepsy, potentially what medications, and also if you have a device like a VNS, DBS, or an RNS, because sometimes there are magnets and things that you can swipe in emergency settings. Seizure detection devices. So this is an interesting topic. It isn't necessarily an endorsement of these products, but I think it's always important to get the knowledge and discuss with your doctor and your loved ones what the risk and benefit is of getting these products. So there is one device that is FDA approved for detection of bilateral tonic-clonic seizures in particular, and that is the Embrace 2 watch. And this is a picture of this right here. It's by Empatica. The way that these work are usually by an accelerometer. They tell if there is certain rhythmic movement over it has a certain detection setting. Now, as you can imagine, with these type of detection devices, there can be a lot of false positives, especially say you're going running or some sort of exercising. There are also apps that connect to smart watches. So a watch you might already have, an Apple Watch or a Samsung watch, there will be apps that can work with those watches to detect seizures similar to the way that the Embrace 2 watch does. There are also movement detectors or MATs, also audiovisual things like monitors. Now, are these necessary for you to go to college? No, but if it's an extra peace of mind that if you're someone that has, when I recommend it to patients is usually in patients that have frequent or at least more common seizures at night in their sleep. So that's more of a SUDEP or sudden unexplained death and epilepsy risk. And I'm going to talk about that a little bit as well. And so I usually recommend if patients are wearing it to wear it when they're sleeping, since convulsions or bilateral tonic-clonic seizures during sleep are more of a higher SUDEP risk and a danger. So I'd rather have people be notified of when that happens. So if you're staying alone or not with a roommate, you can actually set the device to notify somebody when you have a seizure, whether they're in the same room or even in another state. So even having it set up to alert a family member that can call your RA or have it set to let somebody know that you've had a seizure and someone can come and check on you. Again, the thing I want to emphasize is that none of these have been, only one is FDA approved, but so far, none of the data so far has shown that they prevent SUDEP, but it is just another tool in our toolkit to help us be safe with epilepsy. So why is seizure safety important? SUDEP, sudden unexplained death in epilepsy. The risk of this is about 1 in 1,000 per year, but this risk can be higher in those who have frequent or uncontrolled bilateral tonic-clonic seizures, particularly in sleep. The cause, we don't know exactly why this happens. It's definitely, our worst fear and why we are so aggressively wanting to control, especially convulsive seizures. It's thought to be related to the dysfunction of the cardiorespiratory system during a seizure. So the most important way to reduce this risk is seizure control and reducing the risk of breakthrough seizures. So one thing I like to talk about, and now transitioning more into specifics of life in college with epilepsy, is that what is seizure threshold? So a seizure threshold, everybody has a seizure threshold. Now, I always have described as everyone has a seizure threshold. Anybody can have a seizure. Now, people with epilepsy have a lower seizure threshold and are more prone to seizures than the general population. There are certain things, activities, substances, medications that can also bring the seizure threshold down even lower. A lot of these things are also inherent to the college experience. Sleep deprivation, stress, illness, certain substances can all lower the seizure threshold. So these are all things to keep in mind when you're going about your time in college, making sure you get your rest. I know easier said than done, trust me from personal experience, but it is very important to make sure you get your adequate rest. Now, substances. We can't talk about college without talking about some of these things. So alcohol in particular works as a nervous system depressant. So you would think this should stop seizures and be helpful to seizures, right? However, during intoxication, the seizure threshold may actually be higher, but during the more after effect, the 6 to 48 hours post-ingestion, is more of a pro-seizure. So that is what we worry about. Rather than acute intoxication, we more worry about the after effect that your risk for seizure can be higher. And then drinking a lot of time also leads to sleep deprivation, maybe missed medication. All of those things all lower the seizure threshold and increase your risk for seizure. Alcohol can also increase the metabolism of seizure medicines. It can make your medicine leave your system faster. And also it can increase the risk of SUDEP through cardiac effects. My job here is not to say, don't drink, don't do any of these things. I'm just here to give you the information to help make this college experience safe for you. Marijuana. So I like this quote a lot. It is unclear whether cannabis is a hero or a villain in epilepsy care. I took that directly from the paper that I found this. I thought it was a great summary. So in animal models, cannabinoids have been shown to be anti-seizure properties. So the medication is actually one FDA-approved cannabidiol for epilepsy called Epidiolex. Now, this is only used in very severe epilepsy, severe genetic epilepsy encephalopathies like Lennox-Gastaut syndrome, Dravet syndrome, and then, but so not, your average person with epilepsy is typically not taking Epidiolex. However, there's been conflicting reports, and we really can't do randomized controlled trials on marijuana because of the legality of it so far, which has been tied up in the courts. So it's really unclear what the effects are. Some are pro-seizure, some are anti-seizure. So it's just really hard to know. Other things, cocaine can induce seizures in people with and without epilepsy. And then tramadol actually lowers seizure threshold, which is a form of an opiate. And GHB, which is similar to alcohol, it can also increase the risk for seizure in the withdrawal period rather than acute intoxication. Now, something that I think is paramount to discuss, especially with considering college and pretty much just the entire epilepsy population, including myself, depression and anxiety. So lifetime prevalence of depression in those with those with epilepsy is 55%. Anxiety is seen at least 10 to 25%, and so many go untreated. There's a big myth that maybe antidepressants cannot be prescribed to people with epilepsy, and that's just not true. Especially this typical first line, second line medications that are SSRIs, SNRIs, they are safe for people with epilepsy. There's one medication that I usually advise to avoid. It's called bupropion, which can also lower that seizure threshold that I was talking about. But you should always make this decision in conjunction with your psychiatrist, if necessary, your primary care, and your neurologist to figure out what the best medication is for you. And a combination of counseling and medication has been found to be the most safe and effective. And make sure you utilize your support team. Your neurologist, we are here for you, and also your friends, your roommates, your family, your RAs. There are lots of people that hear from you. So make sure if you're feeling depression, anxiety, especially in this new stressful setting, just make sure you know that you're not alone. And lastly, contraceptions, always something I like to discuss with pretty much anybody of childbearing age. It's most important for women to discuss with their gynecologist or neurologist, pick the best and safest option for you. So one thing that I always want people to know, especially if you're on medication like lamotrigine or Lamictal, estrogen containing birth controls can affect anti-seizure medication. So your birth control can make your seizure medications lower, especially Lamictal, probably by about 60%. Also, anti-seizure medication can affect birth control the other way around, making them less effective. So it's just important to know what birth control you're using, what medications you're on, and making sure that the contraception you're using is safe for you, and also that it's not having an effect on your birth control from your medication. So you're off to college. I know that was a lot of information I threw out there and I talked very quickly, but I hope you learned stuff, have fun, be safe, and we are here for you. Thank you so much.